Drama this soon is a little bit crazy.
This is an NBC News special report. Here's Kate Snow.
Good afternoon. We're back on the air because the president's doctors at Walter Reed Medical Center are briefing about the president's condition. Let's listen in.
The president has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7. I'd like to bring Dr. Dooley up to review some more specifics.
Good afternoon. Just a brief update this morning. As Dr. Connolly mentioned, the president continues to do very well. His vital signs this morning were notable for a temperature of 98.1. His blood pressure was 134/78. A respiratory rate of 17 respirations per minute. His heart rate was 68 beats per minute. And his last oxyhemoglobin saturation was 97% on room air. He currently does not endorse any respiratory complaints. And aside from our evaluation with the multidisciplinary team this morning, has maintained a full schedule, ambulating and working on the White House medical unit. I'll now turn it over to Dr. Garibaldi to again discuss therapeutics. Thanks.
Hi, good afternoon. And again, I just wanted to echo the sentiment of what an honor it is to be part of this wonderful team here at Walter Reed. Yesterday evening, the president received his third dose of remdesivir. He tolerated that infusion without difficulty, and his kidney and liver function continued to be normal. Our plan is to give the fourth dose of remdesivir this evening before he goes back to the White House, and we've made arrangements to deliver the fifth and final dose of his treatment course at the White House tomorrow evening. He continues on dexamethasone, and again, the plan for today is to continue to be up and out of bed, eat and drink, and work as he is able. And I'd like to turn it over to Dr. Jason Blaylock, who's an infectious disease specialist and the chief of medicine here at Walter Reed, to give some updates on infection control. Thank you.
Good afternoon, everyone. First of all, I just want to say what an honor it's been to be part of this medical team behind me and to care for the president. Since the president's arrival at Walter Reed, he's received medical management that remains in line with national clinical societal guidelines for treatment of COVID-19 infection. In addition, both myself and Dr. Wes Campbell have worked very closely with various laboratories in the area, state-of-the-art facilities to include USAMRIID and RARE, on obtaining advanced diagnostic testing to really inform the White House medical team of both the status of the president as well as his ability to transmit virus to others. Also, we have worked very closely with the Walter Reed team to ensure that we are looking very closely at infection control prevention strategies and the right posture so that the president can safely return to his residence. And with that, I'm going to turn it over to Dr. Conley, who will answer any final questions.
Thanks, Jason. I mentioned it Saturday, but I'd like to reiterate myself just how grateful the president and I are to the men and women of Walter Reed, our colleagues at Johns Hopkins, as well as the many federal, private institutions that we've received support from. And so long as everything continues on the track that we're experiencing right now, this time, as the president already tweeted out, is to get him home later today. With that, I'll take a couple questions.
Be discharged back to the White House when he was given steroids. You've said that he's still on those steroids. Those are medicines, as you know, that are usually given to COVID patients who are on ventilators or with low oxygen. So did you over-treat him? And if he's still on that medication, how is it safe for him to return to the White House?
So we send patients home with medications all the time. In fact, yesterday afternoon, he probably met most of his discharge requirements safely from the hospital. And he's returning to a facility, the White House Medical Unit, that's staffed 24/7, top-notch physicians, nurses, PAs, logisticians, and the unit here, the team here behind me is going to continue to support us in that nature. Yes.
Conley, what infection control measures are you taking? And how was it safe for him to drive around in a cloth mask yesterday? And how is it safe for him now to return to the White House where there have been so many cases? How is any of this safe?
So the president has been surrounded by medical and security staff for days wearing full PPE. And yesterday, the U.S. Secret Service agents were in that same level of PPE for a very short period of time. We've worked with our infectious disease experts to make some recommendations for how to keep everything safe down at the White House for the president and those around him. We're looking at where he's going to be able to carry out his duties, office space, and I'll just say that it's in line with everything we've been doing upstairs for the last several days.
Can you tell us, please, on testing, can you tell us when he had his last negative test? Was it Thursday? Was it Wednesday? Do you remember when he had his last negative test?
I don't want to go backwards.
Contact tracing for people who are around him?
I understand. The contact tracing, as I understand it, is being done. I'm not involved in that. So.
Why did you begin the reservation that you leave, or was this something he pushed for?
No. So we try to get patients home and out of the hospital as quickly as is safe and reasonable. Every day a patient stays in the hospital unnecessarily is a risk to themselves. And right now there's nothing that's being done upstairs here that we can't safely conduct down home.
That 7 to 10 days was a window that you'd be concerned about. I don't think we're there yet. So do you have concerns about potential worsening or reversal, and what are your plans for addressing that if it were to happen?
You're absolutely right, and that's why we all remain cautiously optimistic and on guard because we're in a bit of uncharted territory when it comes to a patient that received the therapies he has so early in the course. So we're looking to this weekend. If we can get through to Monday with him remaining the same or improving, better yet, then we will all take that final deep sigh relief. But as I said, 24/7 world-class medical care surrounding him down there. We're not going to miss anything that we would have caught up here.
Physically going to be in the White House, and what does that look like? How do you keep him safely quarantined?
I wish I could go into that more, but I just can't.
Why did you begin dexamethasone treatment?
So that has something to do. Yesterday we talked about that, the several little temporary drops in his oxygen, and we had discussed that as a team and elected to start it early in case that persisted or worsened. The potential risks and side effects we all discussed. We looked at the data and decided that we'd rather, push ahead on it than hold and risk, the opposite.
What about CT scans and chest X-rays? What have you seen on his campaigning?
As far as travel goes, we'll see.
His mental status, can you talk to about whether he has any neurological symptoms? Does he have any side effects from his medications? Any fogginess from the virus?
No, I think you've seen the videos and now the tweets, and you'll see him shortly. He's back. Yeah.
Pneumonia or any inflammation in his lungs at all?
So we've done routine standard imaging. I'm just not at liberty to discuss.
Doctor,
so you're actively not telling us what those lung scans showed, just to be clear.
So there are HIPAA rules and regulations that restrict me in sharing certain things for his safety and his own health and reasons.
Share how many times, you said his oxygen dropped several times. Can you share how many times he was on oxygen? You said you checked with the nursing staff yesterday? Yes.
So he the 2 episodes like we talked about yesterday, and both times that he received a little bit of oxygen and recovered immediately.
Was that oxygen required?
No, it wasn't required. He wasn't short of breath. He wasn't looking ill. It was more of us trying to anticipate needs and see how he'd respond. And in both cases, it came right off. He didn't need it from very long at all.
You were on board Air Force One for multiple trips. Are you at all concerned about your own exposure and exposure to the medical team?
I am concerned, but as the CDC says, there are caveats for essential employees that as long as you continue to test negative, you remain symptom-free, and you keep a mask on when you're out and about, which we do inside the hospital 24/7, then you can carry on your duties. Yeah.
I know the president's an impatient man. Has he been itchy to get out of here?
The president has been a phenomenal patient during his stay here, and he's been working hand in glove with us and the team, and today got to the point he's holding court with those of us around him, the whole team, going over all the specifics, the testing, what the future is, and we have been back and forth on what's safe and what's reasonable, and he has never once pushed us to do anything that was beyond safe and reasonable practice that we all first wanted.
Anybody on this medical team who recommended against the president leaving here and going back to the White House today? Or any White House staffers?
No.
Doctor, the president said don't be afraid of COVID. Do you agree with that? Should we not be afraid?
I'm not going to get into what the president says.
His heart, liver, and kidney function was normal or improving. Improving, does that mean that there were effects, and is it all normal? Like, what's up with that?
Yeah, it's all normal right now. I would say he appeared to be a little dehydrated Friday. He was able to just drink and recover from that, and yeah, everything looks great.
Campaigning out in the country, what sort of things do you?
Yeah, so the big first thing that we need to do is that there is no evidence of live virus still present that he could possibly transmit to others, and that's what the infectious disease experts and some of our partners, military civilian entities, doing some of these advanced diagnostics just to see as soon as we can identify that. Routinely we talk about a 10-day window, CDC guidelines, but we're checking him more routinely than just waiting 10 days. There's a possibility it's earlier than that. There's a chance that it's a little bit later, but we will know as soon as possible. And then we will look at him clinically. How are you feeling? How are you doing?
Why have you decided not to administer hydroxychloroquine to the president during his time here?
I'm not going to go into all of our debates about specific medicines and therapies. There are dozens of therapies that we were made aware of, that we considered, that we discussed and debated and looked at, the existing literature on, and this is the regimen we chose.
Taking hydroxychloroquine.
Symptoms of COVID, is he having some of the muscle aches? Has he lost his sense of taste and smell?
No, we were just talking about that, what symptoms he has left, and he's even the slight cough that he used to have, he doesn't really complain of at all. He hasn't ever complained of muscle aches, and yeah, he's up and back to his old self predominantly.
Next Monday, just to be clear, how long will he still be actively shedding the virus?
So this morning, I believe there was even an accounting by Dr. Fauci referencing the first 5 days of illness that people are most likely to shed live virus. There's a reason there's the 10 days is because most people by that time, after 7 days, most folks don't have culturable live virus. They put it to 10 just to give some extra space. It's never 100%, between everybody. So we'll see. I'm not going to put a specific number, but we look at that window is all I say.
Will the president be confined to his residence, or will he be allowed to return to the Oval Office?
We're going to do whatever it takes for the president to safely conduct business wherever it is he needs to do within the residence and White House.
And is he on blood thinners? And also, has he been using, have you been giving him Tylenol, Advil, anything?
Oh, that came up. I would like to say he has not been on any fever-reducing medications for over 72 hours.
What about the blood thinners?
Yeah, he's on a routine regimen of COVID therapy. I'm not going to go into specifics as to what he is and is not on, but.
You said I'm going to read this here that the president had a mild cough, some from nasal congestion and fatigue on Thursday. Now, back to my colleague Jen Jacobs' question. The reason knowing when the president's last negative test is important. For that reason, your words, what you said, and also for the contact tracing. But would you recommend it that, given those symptoms, that that the president go to that Bedminster fundraiser?
It's not up to me necessarily, the president's schedule, but I would say that it wasn't until after he returned that we really sat down, then knowing the news of the day, that we really dove into how are you feeling, what's going on.
Those were the symptoms he was experiencing on Thursday.
I'm not going to get into, operations.
When was his last negative test, and what was his viral load?
I know, everyone wants that. Yeah, I don't have his viral load. Those are some of the diagnostics that we're sending out that will really tell us when it's safe for him to get back out and around people.
What did you say when the last negative test was?
Any abnormal tests? Were any of his lab tests abnormal?
I'm not, again, HIPAA kind of precludes me from going into too much depth and things that I'm not at liberty or doesn't wish to be discussed. At some future point, maybe, but today, sorry. I think that's it. Yeah.
Thank you, guys.
Thank you.
Thank you.
All right. Thank you.
Thank you.
All right, you've been watching the president's team at Walter Reed Medical Center, notably his personal White House physician, Sean Conley, doing most of the briefing there. I want to just summarize a few things, and I'll bring in our senior medical correspondent, Dr. John Torres. But just to summarize, the team saying that the president continues to improve. He is going home around 6:30. The president tweeted he will be Eastern time heading back to the White House. His doctor saying he may not be entirely out of the woods yet, but that he's improving. He said everything looks great in terms of his vitals and other testing that they did this morning. He will be surrounded by, in their words, world-class medical care at the White House. Did not clarify where exactly he'll be allowed to be inside the White House complex. He was given a 3rd dose of remdesivir yesterday. We'll get a 4th before leaving tonight. And then the 5th dose of that drug will happen tomorrow. Dr. Torres, he did also say we are in uncharted territory here because this patient has had a series of medicines, a grouping of medicines that really no one else, very few people in the world have had this early in the virus.
And Kate, that's one of the things they said that kind of piqued my interest, that they're in this new territory of giving him these medicines, giving him the 3 medicines, but early on in the course of coronavirus or COVID-19, which they usually reserve until patients are further along and they're more severely ill. And so they don't exactly know how that's going to do over the long term here. And like you mentioned, they said, he's not going back to a normal house. He's going back to a place with 24/7 care. There's going to be physicians, there's going to be PAs, there's going to be nurses on hand. There's a lot of things they can do there. And so it's essentially going from a hospital to a hospital type setting, although they don't have the intensive care services they have at the hospital. And one of the other things he mentioned, again, like you said, that he's not out of the woods. But they did say that when he goes to the White House, we aren't going to miss anything that we catch here. And what we're seeing right now, when they gave us the vitals, they gave us all that, is a snapshot into what his condition is right now. But it's just that, it's a snapshot. And as we know with coronavirus, this thing can change very quickly. That 7 to 10 day time period, which is, depending on how you look at it, sometime between Wednesday and the end of the weekend. That's the crucial time period. That's when they're really going to have to follow him closely. They also said they're monitoring his viral load through these testings, and they'll know when he's no longer infectious. That's interesting as well, because that's not something we typically do. So it'll be interesting to see how that goes over the next few days and over the next week or so, Kate.
Dr. John, stand by. Let me go to Dr. Vin Gupta, who's also with us. He's an ICU doctor, an NBC News medical contributor. You treat patients with COVID all the time. What did you hear there in that briefing? And does this sound like standard care or something very exceptional for the President of the United States?
It's definitely the latter. This does not sound like anything I know my colleagues and I have been doing since March, which is evidence-based medicine, or at least willing to discuss cases openly if we're going to deviate from any standard of practice. Let me elaborate here. On the NIH website, there is a website called COVID-19 Treatment Guidelines. anybody can see, all your viewers can see, that dexamethasone is to be prescribed until hospital discharge, and then you stop it. And you should only prescribe it if somebody is on a ventilator or requiring a significant amount of oxygen. Those are the criteria. There is no criteria where you say, let's prescribe this medication, this really powerful steroid, to prevent a bad outcome. That's just not what it's approved for. Same thing with remdesivir. And neither of these drugs, one, so there's no indication for it in the president's case. And number two, he shouldn't be going home, even if it's the White House, with either of these medications. They should be administered in a rigorous clinical setting where there's frequent monitoring.
But you heard his team say again and again, he will have the same standard of care at the White House. He will have, a high-class medical team around him, 24 hours. He will be isolated in some way, although they said he may. It was unclear if he would be in the Oval Office working. He said he'll be working wherever it's safe. I guess my question is, isn't this a different situation, and is it okay to be in a White House setting when you've got that whole team around you?
Perhaps. I mean, if he has all the same types of accoutrements as an acute care hospital, then fine. We can say that it's essentially the same thing as what he's leaving at Walter Reed. But the fact remains, why is he getting treated with these agents in the first place? I think critical gaps were revealed at this press conference. Number one, why didn't they invoked HIPAA privilege when the reporters asked about chest imaging? But they were willing to share all types of other medical data.
About the lungs.
So why are they about the lungs? And that's key here, because in the setting of shortness of breath, in the shedding of reported cases of multiple declines in oxygen levels, given his treatment course, one wonders, does he have pneumonia from COVID-19? And why aren't they just willing to say that? Because it would be understandable then. It would make the American people understand, all of us understand, why they're doing what they're doing, and we could put this to rest, and we'd be glad that the president's doing better. But the fact that they're obfuscating on that is challenging. The fact that he didn't comment on why he cleared the president to go out for his joyride yesterday, that has been deeply troublesome to all of us in healthcare, because we're so painstaking when it comes to infection control, and the president can clearly put others at risk. Why didn't he talk about that? He didn't talk about blood thinners. I think the president, we don't know really anything about the nuance of his labs, but we now know, relative to March, that blood thinners can be an important part of therapy. What's wrong with sharing is the president or not getting standard of treatment for blood thinners. It's a major component of COVID-19 therapy. So critical details were left out. I think we don't have a fantastic amount of information about what's actually occurring, but it's good to hear that the president's doing better per their report.
Well, let me go to Chief White House Correspondent Hallie Jackson. She's at the White House. Hallie, to pick up there, it would seem that the doctor was told by the president what he could release and what the president is not comfortable with him releasing, because there were several times when he invoked HIPAA, at times when he didn't want to go further, and you would guess that that's an individual, here the president, saying, I don't want that publicly revealed.
Well, you heard as much, it seemed, Kate, from the end of that news conference, and he was taking questions where he said something, and I'd have to go back and listen to the tape, about how doesn't wish for it to be discussed, essentially. And it was almost, frankly, a cherry-picked HIPAA situation, because Dr. Conley was revealing some very personal and medical information about President Trump in some instances, but not in other instances, which, of course, leads to the question, why? Why is that, right? Why did we get no answer, for example, on the pneumonia question, on the lung scan question? Why are we getting no answer on the last negative test? That is so important, because as my colleagues in the White House press corps who are at Walter Reed point out, that determines who potentially could have been exposed to President Trump while he was contagious. We did learn about some other symptoms. He no longer has he no longer has a cough, for example. He has no fogginess from some of these medications, sort of mentally. That had been a question about a potential side effect. But what was interesting to me was that Dr. Conley was taking, in some ways, the role of the president's spokesperson out there, not from a medical perspective, but perhaps from a political one, saying, yeah, you know, he's back. He's ready to get out there. He's ready to go. His medical assessment, but of course, that is something that President Trump would want Dr. Conley to say. We know that the president, as we've talked about, is an impatient patient. He wants to get out of the hospital. Kate, I don't know that anybody wants to be in the hospital any longer than they have to be. But Dr. Conley acknowledging, I think importantly, that the president is still not out of the woods yet. He didn't nail down when specifically he felt like the president would be able to leave isolation, nor, interestingly, Kate, that he specified specify where the president would be in isolation. We know the president will be at the residence, obviously, but there's a question, does he go to the Oval Office, which is in the West Wing, of course, a separate part of the building, to do his work? Dr. Conley made it sound like that will be an assessment that they will take moving forward. He also, when it came to that negative test, said he didn't want to go backwards and talk about things that happened in the past. But Kate, as you know, and as our medical experts here on this broadcast know, that is so important when it comes to figuring out who else could be at risk. Going backwards is how you determine that piece of the puzzle. Especially, Kate, that is relevant when we know that there are now 14 people total, 13 other than President Trump, linked to the White House and campaign who have tested positive for the coronavirus in recent days. So this is clearly something that there needs to be more discussion about, more questions about, and frankly, it'd be nice to get some more answers about it too. Kate?
White House correspondent Peter Alexander is outside Walter Reed Medical Center, and I just want to go to him because, Peter, it's a scene behind you there. I imagine for his supporters, this is exactly what they wanted to hear.
Yeah, that's exactly right. The numbers have swelled, maybe 50, growing into 100 over the course of the day. A lot of honking as folks pass by Walter Reed in anticipation of the president's departure today. Many of them still celebrating the moment they got to see him yesterday and that much scrutinized, much criticized impromptu drive-by here. But I'm struck by the president's tweet a little bit earlier today, Kate, when he announced his departure from Walter Reed. He said, among other things, don't be afraid of COVID. Don't let it dominate your life, which is going to be an interesting message from this president as we head into the election now less than a month away, given the fact that more than 200,000 Americans have already died. How that will sit with many Americans, with the families of those who have lost their lives. We know the president is trying to turn the conversation away from COVID. Obviously, these last several days have made that increasingly challenging. It's clear that that's his desire again, but whether Americans don't view this as a frightening, contagious, infectious disease at this point because the president may be going home with elite doctors and access to an exclusive array of drugs, I'm not sure how that message is going to go for most Americans.
Peter, thank you. Quickly, I want to go to Joseph Fair, who's a virologist and a contributor to NBC News. On what Peter just said, this messaging that the president's putting out there that COVID isn't so bad, what is that from a public health perspective?
It's a disaster, Kate. I mean, you're telling everyone that supports you to ignore COVID. You had the best care. You got experimental treatment very early on. They knew the moment that you were positive, just because the test is being done on you daily, several times per day. And your average American doesn't have access to that. And, as Peter just said, the families of over 200,000 individuals would tend to disagree that COVID is nothing to be worried about. And, if I may, Kate, I noticed in the press conference, one thing that you would not get the physician to say is that the president is virus negative. So he is knowingly discharging a positive patient, which to my knowledge would not happen in any other case, back to a home setting where they're going to run into administrative personnel as well. And I find it really hard to believe that you can implement hospital-level infection prevention and control in the White House, especially if you're going back and forth between the East and West Wings.
They say that they're working on that. As Hallie Jackson said, there are a lot of questions to be answered in the hours to come. Joseph Fair, thank you. Thank you to all of our contributors and our correspondents who have been with us. We will have much more, as you may imagine, on Nightly News. Lester Holt is in Miami tonight. He's also hosting a town hall live from Miami with presidential candidate Joe Biden. That starts at 8 p.m. Eastern, 7 Central. But first, Nightly News before that. I'm Kate Snow. For all of us at NBC News, have a good day.
We now join our regularly scheduled program already in progress.
Sandler, when you're here